Good morning, everybody. This is the third year Vattikuti Foundation is organizing Robotic Surgeons Council meeting. Now with the growth we have issues which grow up. At the outset, I welcome Dr. Peter Wickland and Nikhil Vasudev to have accepted our invitation at a very short time. And Peter, this is the first multidisciplinary model in the world. And it's very difficult for doctors to work together, particularly. We are in silos, and we had our share of problems. But in this experience of 5 years, we realized that it has its dividends also. For the first time, we have, because there is tremendous demand from the residents and fellows for 2 years, all of them want to learn robotic surgery. But they need to realize that any surgeon who wants to learn, it's not like a course you can do and use it after 10 years. Until you have a close access to robot, you can't really train them. But in order to bring them into the fold, Foundation has a program, what we call Vattikuti Scholar Development Program, where we nurture these residents in a gradual manner. We have an engagement model of webinars for them, and from there, those who are interested, they apply for travel bursaries to attend these meetings and Foundation funds. This time, the largest number of applicants were there. Last year, we funded 9. This time, out of 70 applicants, I had to fund 35 of them. And then 15 of them, those who were not approved for relative merit, approached us that could they come on their own. So there are lots of people who have paid for and come here. Now, they have come to the fold, but to keep their enthusiasm is a challenge, and it's a challenge not only to me, but the senior colleagues. This happened in the United States also, our program. I don't know about Sweden. 5 years ago, good residents would not apply for robotic surgery. No, to our institute. Simply, we are heavily biased on robotic surgery, and we want to learn the whole urology. And the tide had turned 360 degree. And now for 3 years, we have been matching 1 and 2. Out of 130 applicants, take 2 of them. And all of them come because now they have realized that there is no way they can get away without computer-assisted surgery. The surgeons, the quality of surgery also went up price, because from time to time we keep bringing mentors like you to come and demonstrate, see the work. And what feedback I get is that the quality of work, particularly to complement the gynec oncologists, we don't have a large group, but very nice words from mentors. And many times the patients come and contact Foundation for consulting the mentors. We take them, and they say that otherwise they should come. You have so-and-so, and they should go to him, because we are extremely pleased. And I'm not surprised, having part of this fraternity, that we have all the ingredients, like we have high volume, we have terrific infrastructure, we have a patient who is non-complaining. Now they are getting westernized gradually. We don't have lawyers' attention to this area yet. So it's very different environment than United States. So now we have a session where we are going to brainstorm and see that what course of growth they should take. I would like to assure the members here for their cooperation, and every time I say that Foundation has no agenda. Foundation is just a facilitator of growth in the right direction and developing high level of competence for ultimate benefit of the patients. Thank you very much. I know it's not easy for you to travel all the way leaving your works, particularly because of some logistic issues. We had to move this meeting to a working day. Otherwise, usually we do it on Saturdays and Sundays. And for 2 years. This is third meeting. Initially, we were doing all meetings at one place in a hotel, but now we have started rotating these meetings with the specific purpose that it gets a boost to these centers. And it works as a way to train the administrators also. Otherwise, two guys going and pleading him for something on extra robotic time doesn't work, but when they see that really it's not a hoax, it's not a gimmick, it is something which they would not be able to avoid, it helps a lot. So I welcome you to this meeting and look forward to a very exciting program which has been put together. I thank Dr. Arvind Kumar and his team, particularly Rajiv Kumar, who had put up this program together. We have tried to accommodate everybody, those who have significant volumes, and there has to be a cutoff point, because if you see that we have 109 surgeons operating robotics, but we are able to invite 30 to 35 people, those who have a claim on being as a faculty member. But this is growing very fast, and we'll discuss how do we shape. So I think without wasting too much of time, I welcome you once again and look forward to have your contributions for this meeting. Feel free and tell, but we'll have to evolve a consensus, because I know that nobody likes more urology, and similarly, urologists would not like to listen to a transoral surgery. Those are interdisciplinary things, but still, there is a common thread which binds that ultimately it is the robot which you need to learn. Nobody needs to teach and experience urologists how to remove a bladder and make a conduit. All we are talking is how do we use robot to achieve the same objective. Thank you very much. Once again, I thank Apollo Hospital for readily agreeing to provide their infrastructure and helping us organize this meeting. Thank you.